சார் வெல்கம் அட்ரஸ் சார். அடுத்த வெல்கம் அட்ரஸ் இதில் பண்ணிடுங்க சார். இதிலே பேசிடுங்க சார். அது கனெக்ட் ஆகலையா சாருக்கு? To make this event more blissful and dazzle, I invite our most respected head of the department, Dr. Faisal Mohammed sir, to welcome the gathering with his warm and elegant words.
Secretary Sahib, Treasurer Sahib, Assistant Secretary Sahib, revered principal in absentia, and our esteemed resource person and chief guest, Dr. Divya Prakash. My fellow professors, my dear students, I'm happy to be associated with you in this special lecture program. Normally, we arrange such type of programs in the offline mode. Now, due to the pandemic situation, we are forced to go this type of mode. Even though we experience a certain inconveniences, we are enthusiastic in arranging such type of events just to give, just to improve, just to update the knowledge of our students. Our students must take these opportunities, grab these opportunities to develop themselves. This gives this type of events help the students to update their knowledge. Nowadays, they have to go along with the society. They face many, the student community face many competitions. The days are not so easy to surpass. Therefore, they have to equip themselves. They have to empower themselves. Our college provides a lot of opportunities to our students. And the students studious they themselves get empowered. யாரு டைம் வேஸ்ட் பண்ணாமல் அவங்க எஜுகேஷனுக்காக செலவு பண்ணுற மணியை வேஸ்ட் பண்ணாமல் எல்லா ஆப்பர்ச்சுனிட்டியும் யூஸ் பண்ணிக்கிறாங்களோ they will definitely will be successful in their career as well as in their life. இப்போ இவ்வளோ கஷ்டப்பட்டு இந்த மாதிரி ப்ரோக்ராம்லாம் அரேஞ்ச் பண்ணுறோம். இந்த மாதிரி எமினன்ட் பர்சனாலிட்டிஸ் ஃப்ரம் அதர் இன்ஸ்டிடியூஷன் நம்ம கொண்டு வந்து இந்த மாதிரி ப்ரோக்ராம்ஸ் உங்களுக்கு கிளாஸ் அவர்ஸை விட்டுட்டு இந்த மாதிரி ப்ரோக்ராம்லாம் அரேஞ்ச் பண்ணுறோன்னு சொன்னால் சும்மா சாதாரணமாக அப்படி டக்குன்னு பண்ணிடல. அது வந்து உங்களுக்கு பிரயோஜனம் ஆகணும். ஸ்டூடெண்ட்ஸுக்கு இந்த மாதிரி உங்களுக்கு அப்டேட்டடாக இருக்கணும் அப்படிங்கிறதுனால இந்த மாதிரி ப்ரோக்ராம்லாம் அரேஞ்ச் பண்ணுறோம். அதுக்கு நாங்கள் ஒரு நல்ல ஒரு எமினன்ட் பர்சனாலிட்டி பயோ இன்ஜினியரிங் டிபார்ட்மெண்ட் சாஸ்திரா தி ரினவுண்டு யூனிவர்சிட்டி அதுலேருந்து டாக்டர் திவ்யா பிரகாஷை நாங்கள் கான்டாக்ட் பண்ணி உங்களுக்கு இந்த லெக்சரை உங்களுக்கு சார் உங்களை பேசுறதுக்கு இருக்காரு. I welcome Dr. Divya Prakash amidst his busy schedule, tight schedule of program. He has accepted and he has responded to our invitation, and he is going to give a lecture for you. லெக்சர் கொடுக்குறாருன்னா நீங்கள் வந்து அந்த லெக்சரை நீங்கள் எப்படி லைட்டாகவும் எடுத்துக்கலாம், அது வந்து என்ன நீங்கள் உங்களுடைய லைஃபுக்கு தேவைங்கிற மாதிரி எடுத்துக்கலாம். இந்த லெக்சர் மாத்திரம் இல்லை, எல்லா லெக்சரும் வெளியிலேருந்து வர லெக்சரு, நம்ம டீச்சர்ஸு கொடுக்குற லெக்சரு. அதுக்காக தான் உங்களை கைட் பண்ணுங்கிறதுக்காக தான் நம்ம டியூட்டோரியல் ஸ்கீம், நம்ம காலேஜில் நிறைய ஸ்கீம் வச்சுருக்காங்க. உங்கள் டியூட்டர்ஸை பார்த்து உங்களுக்கு தேவையானது கேட்டுங்க, உங்கள் டியூட்டர்ஸை பார்த்து உங்கள் நாலேஜை இம்ப்ரூவ் பண்ணிங்க, உங்கள் டீச்சர்ஸை பார்த்து நீங்கள் கைடு உங்களுக்கு கைடாகவும் இருப்பாங்க. அதனால் உங்கள் டீச்சர்ஸ்கிட்ட மேக்ஸிமம் பெனிஃபிட்டை நீங்கள் எக்ஸ்ட்ராக்ட் பண்ணிக்கிங்க. அவங்க எல்லாமே உங்களுக்கு ஹெல்ப் பண்ண ரெடியாக இருக்காங்க. நீங்கள் பொடுபோக்கையாக இருக்காமல் உங்கள் லைஃபு சரி தானே. அதாவது படிக்கிறதுக்கு ஆப்பர்ச்சுனிட்டி கிடைக்கிற பர்சன்டேஜ் 14% சொல்கிறான், 14% 17% சொல்கிறான் ஹையர் எஜுகேஷனுக்கு வர்றது. இப்போ அந்த பர்சன்டேஜில் நீங்கள்லாம் வந்துடுறீங்க. இப்போ இந்த மாதிரி டைமில் நீங்கள் லேர்ன் பண்ணுறது தான் வந்து என்ன ஆகும், பிரெயினில் நிற்கும். பாக்கி வயசான பிறகு கேட்டால் அதெல்லாம் வந்து பிரெயினில் பைண்ட் ஆகாது. அதனால் இந்த டைமை நீங்கள் நல்லா பெஸ்ட் யூட்டிலைஸ் பண்ணி யூ மஸ்ட் extract maximum work, you must extract maximum benefit from the institution as well as from our teacher. Now I welcome all my colleagues, all my staff members. நம்ம ஸ்டாஃப் மெம்பர் பற்றி சொல்ல வேண்டியது, ஒவ்வொருத்தவங்களும் they are unique in their own field. ஒவ்வொருத்தவங்களும் அது மாத்திரம் இல்லை, they are டெடிக்கேட்டட் டீம் நம்மள்கிட்ட இருக்குது. உங்களுக்காகவே எப்போவுமே, அதாவது நீங்கள்லாம் வீட்டில் இருக்கீங்க, அவங்க டெய்லி காலேஜுக்கு வராங்க. நம்ம ஸ்டாஃப் மெம்பர்ஸு டெய்லி காலேஜுக்கு வந்து இந்த ரிஸ்க் இருக்குது, பேண்டமிக் ரிஸ்க் இருந்தாலும் உங்களுக்காக வந்து இங்கே வந்து என்ன பண்ணுறாங்க, இப்போ லேபில் ப்ரிப்பேர் பண்ணுறாங்க. உங்களுக்கு ஸ்டடீஸு, உங்களுக்கு அந்த ஆன்லைனில் கிளாஸ் எடுக்கிறதுக்காக எல்லாம் ப்ரிப்பேர் பண்ணுறாங்க, இங்கே வந்து ப்ரிப்பேர் பண்ணுறாங்க. சரி தானே. அது மாத்திரம் இல்லை, லேப்லேயும் எக்ஸ்பெரிமெண்ட் செஞ்சு உங்களுக்கு அது வீடியோ எடுத்து உங்களுக்கு காமிக்கிறாங்க. இவ்வளோலாம் உங்களுக்காக கஷ்டப்படுறாங்க டே அண்ட் டைம். அப்படி ஒரு டெடிக்கேட்டட் டீம் உங்களுக்கு ஸ்டூடெண்ட்ஸுக்கு கிடைச்சிட்ருக்கு. அதனால் நீங்கள் இதெல்லாம் வந்து பெஸ்ட் யூட்டிலைஸ் பண்ணிக்கணும். அப்போ ஐ வெல்கம் ஆல் மை டீச்சர்ஸ், ஆல் மை ஃபெல்லோ ப்ரொஃபஸர்ஸ், அண்ட் ஐ வெல்கம் ஆல் மை ஸ்டூடெண்ட்ஸ். எஸ்பெஷலி ஐ வெல்கம் அவர் resource person, Dr. Divya Prakash. Thank you one and all.
Thank you, sir. Thank you for your wonderful words. If you are working for something that you really care about, you don't have to be pushed. The vision pulls you. It's time to introduce our well-esteemed resource person. To introduce our resource person, I invite Dr. V. Kavita, Assistant Professor of Nutritional Dietetics, to introduce our resource person.
Good afternoon, It's a great honor for me to introduce our chief guest, Dr. G. Divya Prakash, working as the Assistant Professor in Department of Bioengineering, Shastra Dean University, Tanjavur. He completed his PhD in Department of Microbiology and Cell Biology, Center for Nanoscience, Indian Institute of Science in the year 2014. Completed his postdoctoral research associate at the University of Nebraska Medical Center, Omaha, USA, on topic long-acting nanoparticle to treat HIV infection. He demonstrated for the first time that autophagosomes can be used to load nanoparticle to increase the half-life of the drug. He received DST Inspire Faculty Award, and now he is Lab is working on drug delivery system to treat the infectious diseases, and he has over 30 peer-reviewed research publications to his credit. Welcome you, sir.
Thank you very much for your kind introduction, madam. And I thank everyone from JNC to give me the opportunity to talk about Corona and during this pandemic situation. So again, I thank the head of the department and Dr. Bhuvaneshwari and Dr. Kavita ma'am, and for the kind introduction. So, shall I start? Is it whether the audio is clear?
Yes, sir. Yes, sir.
Yeah. Okay. So I will start sharing my screen. So is the screen visible to everyone?
Yes, sir.
Okay, fine. So they have introduced. I'm Divya Prakash, and I'm working as a DST Inspire faculty at Sastra University Center for Research in Infectious Diseases at School of Chemical and Biotechnology. So, at Center for Research in Infectious Diseases, we are working on the various different infectious diseases from bacteria to virus, and it is it gives me a pleasure to mention that it has been approved to have a BSL-3 facility here at Sastra University, because there are very few places in India, even in Tamil Nadu, to have a BSL-3 facility, which is required to work with SARS-CoV-2 or coronavirus as of now. So it will be established in a year or so here, and in future we will also start working at Sastra University with those infectious diseases. So with that, I start with the title. So it is around the coronavirus in 10 months. So it started, the first case was reported in India January end, and now almost 10 months is over, and at March, it was WHO announced that it's a pandemic. So we will get into that everywhere. So what happened from the beginning until now, what is there, and how coronavirus or SARS-CoV-2 which infects, and what are the differences in that, and how we can have the treatment, what are the different ways we can have treatment. So this will be the overview of the presentation, and I'll start with few questions. So which organisms global dry mass, so that is around 200 to 700 times more than the total human biomass, and the which organisms counts almost the same or slightly more than the total number of cells of a human body. So we have around 30 trillion cells approximately. So it was estimated based on the weight and the size of cells and volume of the body. So and which organism caused more than 90% of pandemic? So the answer is simple for all the questions. So the answer is virus. So So virus, as per so Medaworth, so he was known as uh, the, he's a British scientist. So he mentioned virus as a piece of bad news wrapped in protein coat. So though there are some technologically sound techniques are there with virus, but most of the time it's a bad news if there is a virus. So apart from most as we have as I mentioned, more than 90% of the pandemic is caused by virus. One pandemic in 13th century, where it wiped out half the population of Europe. So that is not caused by a virus but a bacteria. So a bacteria Yersinia pestis, again uh, around 200 million people died because of that, with that virus. So So we were talking about coronavirus and COVID. So as of now, in the world, there are more than 4 crore people, or 40 million people, or in total, they are infected with coronavirus. So SARS-CoV-2 is the virus name, and COVID-19, so coronavirus disease. So COVID-19 is yeah. Around 40 million people worldwide, and around 1 million people died because of COVID-19. And in India, almost 1 lakh people died, and uh, 75 lakhs people are infected with 75 lakhs people they are infected with the coronavirus in total. So we'll see how the spread and what is the status now. So if you see the history of pandemic, so it started early back, and the name pandemic, so pan demo, so from Greek word, so the pan is meaning is all, and demo is people. So most of the people are infected with the microorganism. So in that case, it is called a pandemic. So worldwide, there are so many different pandemics. So mostly it is caused by virus. So throughout the history, many people died because of these pandemics. So if you see the Black Death in 1347 to 1351. So it stayed there for 3 years almost. So in that case, they around 200 million people died because of that. So that was almost it wiped out half the population in Europe. So apart from that, and some uh, uh, plagues again, which caused by Yersinia pestis, the Antonine plague caused by Yersinia pestis. Most of the flu, or the SARS, Ebola, MERS, HIV/AIDS, again from 1981 to present, it is still difficult to find a cure. So we were working with HIV infection. So when I was doing my postdoc, and it requires a BSL 2, so that is biosafety level 2 plus, and a BSL 3 facility to work with. So where there will be negative pressure, so that there will not be any movement of air from inside to outside. So that's how the environment is controlled in BSL 2 plus or BSL 3 facility. There, when we were working with that, again, we were trying to find long-acting nanoparticles to give injections once in a month, or once in 6 months, or once in a year, because a person who gets infection, HIV infection, the age of 20 years, so he can survive. The mean lifespan is around 65 years. So in normal cases, it is around 70 to 75 years, the normal lifespan of a person. Even if he gets AIDS or HIV infection, not AIDS, HIV infection, he can survive the mean uh, age or lifespan is around 65 years because of these antiretroviral drugs. But the problem is they need to take the drugs regularly, the antiviral drugs, and there are so many side effects of those drugs. To one example to mention, so we were working with graduate students, so they are the PhD graduates. So I was giving training to them, and one of the graduates, we were working with the mice model. So that is humanized mice model. So HIV, the name denotes that it infects the human immunodeficiency virus. So it can infect human, and it cannot infect normal mouse. So in that case, we need to humanize the mice. So we need to take the nude mice, immune compromised mice, and inject with the human stem cells, and we make sure that the uh, human cells are populated, mostly the immune cells are populated in the mouse, and then we infect them with HIV, and regularly we need to bleed them, because to all the experiments and all, we require blood. So in that case, it is very difficult to bleed. Also, we give injections to them. So first time he was handling that, and normally we wear two gloves, and sometimes the beginners, so they have a very uh, shark proof gloves, so that it will not injure any of the person while handling the HIV infected mice, because those HIV, again, if it enters, and it is very difficult to treat. There is no cure for them, right? So we make all the precautions with that person who uh, gets a small bite from the mouse while handling that, and he was not sure whether the teeth get inserted, and it was HIV infected mouse, and the HIV population was really huge. So he was worried, and immediately we need to report, and the procedure was he needs to take antiretroviral drugs for a month, and then he needs to all the testing, and then make sure that he is positive or negative. So he had to take the medicines for a month, and every day he will get all the fever, vomiting sensation because of these side effects. So it was very difficult if a person is taking the medicines for more than 60 years long. So that's why we were trying to develop. So recently, the lab I was working, and they found some cure. So 50% of the mouse population uh, uh, cured from HIV infection, and they have used CRISPR-Cas9 technology. So that was effort, and like once in 6 month injection also, it was going to be under clinical trial. So there are so much progress in case of HIV, and it was there from 1981 to present. COVID, it just started only 10 months. So we are going to see in 10 months. So in HIV, if you see, there are like 20 years of HIV. So many research has been done, and still we have not found complete cure. So with the CRISPR-Cas9 technology, as you are aware, the Nobel Prize was given in physiology and medicine this year for the CRISPR-Cas9 technology. And with that, it was maybe in future there should be a cure for even HIV infection, and we will also discuss about how the technology can be used, various different other technology can be used for curing COVID-19. Unlike HIV infection, it is the genome is not integrated into our genome, so that was the problem with HIV virus. So if you see the WHO, they officially mentioned on March 11th as COVID-19 pandemic situation, right? So lower to higher side. So the cholera outbreak, SARS or MERS, so around 770 people died of SARS, but the mortality rate is really high for SARS as well as for MERS. So it is around 10 to 20%, it was estimated. And for Ebola also it was high, but the transmission rate was really less in case of SARS, MERS or Ebola. But in case of again COVID-19, which is there, so as of today around 1 million people died of COVID-19, and the spread rate is really high. So that was the reason, though the mortality rate is really less in case of COVID-19, the around 1 million people died worldwide. So again, HIV, 25 to 35 million people died because of that, and smallpox in 15th century, Spanish flu or plague or Black Death. So this is the 14th century. So around 200 million so around 200. Black Death. So that is due to Yersinia pestis. Okay, so the SARS-CoV-2, the severe. Just a minute, I have some not very stable. Sorry for the interruption. And yeah, SARS-CoV-2 we will discuss. So the severe acute respiratory.
Speaker mute பண்ணுங்க.
Okay, is that clear now as of now? The slide. Okay, so SARS-CoV-2, it is a severe acute respiratory syndrome, coronavirus 2. And so this is the virus name. So it was previously discussed as novel coronavirus, and they have named now SARS-CoV-2 because it have resemblance of the SARS. And because of that, it is SARS-CoV-2. So SARS-CoV coronavirus, previously it caused SARS, and it was more related to SARS-CoV rather than MERS, so Middle East respiratory syndrome. So that's why they have named SARS-CoV-2. And COVID-19 is the coronavirus disease 19. So the name suggests corona. In Latin, it is called garland or crown. So if you see coronavirus, so on the surface you can see a crown-like structure. So that's why the name coronavirus. So these are the spike proteins, and it's a single-stranded RNA protein, and it is the largest RNA genome among all known RNA virus. So one of the largest uh, genome virus, RNA virus, and it has three membrane proteins. So one is the S glycoprotein, and the matrix protein, and the envelope protein. So envelope protein in the envelope, and glycoprotein. Now with the this S glycoprotein, which binds to the angiotensin converting enzyme 2, which is there in the lung epithelial cell. So that is called ACE2. So this binds to the ACE2 angiotensin converting enzyme, and then the coronavirus can enter into the cell. So we will see in a while how so the single strand RNA you can see, and the nucleocapsid which is present in the RNA, the spike glycoprotein. So this gives the corona-like structure. The envelope protein and the esterase dimer is they are present in the surface of the coronavirus. So coronavirus, they are not very new. So they are there from early 90s. So from 1960s, it was identified the human coronavirus, and there are already 4 endemics of human coronavirus, and they are really very mild symptoms. So, but the scenario changed. Normal cold-like symptoms in case of coronavirus, but the
Excuse me, sir. Press Shift F5, sir. Shift F5, sir.
it's Mac. Yeah, sorry for the interruption. And it was having very mild symptoms, and the scenario changed. In 2002, 2003, the fatality rate was around 10%. So at that time, it was named the SARS-CoV. So that time there was so much distress happened, and now though the mortality rate is comparatively lesser, and so the full screen, there was some issues, I think. Sorry for that. Okay, so the first case, it was reported on January end. So in India, it was only one case in India. So at January 30th, and the World Health WHO report, World Health Organization report on January 31st, it was reported only one, and then at February 13th, so within uh, 10-15 days, it was still only three cases in India. And then the scenario started to change at March 22nd, when the lockdown was announced. It was around 353 cases, and uh, there were around seven casualties because of COVID-19. So that time, almost many places there was spread of these novel coronavirus disease. At that time, it was reported that it was novel coronavirus diseases, and then only the name had changed to SARS-CoV-2. So then April 5, so from March 22nd to April 5, around in 15, 20 days, there were around 10 times increase in the cases. So 3,500 cases, and there are more than 80 people died because of COVID-19. So that time there was a lockdown has happened, and then slowly in India there were increased number of cases, almost 250,000 cases in during June 14th. So that time there was the report. So the it was reported by ICMR at that time, the Indian Council of Medical Research Director. So he mentioned that it is it cannot be stopped, the spread. So just by lockdown, it was very difficult because many people already infiltrated into that population. But these restrictions, they gives time to the government to start the facilities, the hospitals, and prepare for these pandemic conditions. So that's what the government did, and obviously there were many political reasons and other social economic reasons to open up those lockdowns. And now we will see what is the scenario as of now at the end. And slowly people started to live with COVID-19 or coronavirus. So that's how it was started. And that time, during that time, there were so many different myths. It was prevalent. So COVID-19 can spread through parcels from affected countries. So these are the myths. And in India, around 54% people, they believe that. And the exposure to sun or high temperature, that prevents COVID-19, and the garlic prevents COVID-19. Then the pets can transmit COVID-19. So these are some of the myths which are prevalent at that time. So many of the Indians, so they responded that they believed in the myth. So even alcohol consumption, they believe that it can cure from COVID-19, and which is not true. And these lockdown, during that lockdown, so obviously there were so much of changes, lifestyle changes. So the watching online videos, they increased around 60%. So just imagine before lockdown and after lockdown, just increase in 60% more people, or more time online videos are being watched, and watching TVs and movies more than 50 percentage. And social media around 48% increase, chatting, texting. So everything had increased, playing video games and reading books, not much increased, but all other activities, online activities had increased. So even the conferences, webinars, so we are conducting those online mode of way of teaching has also been increased so much. And uh, students, I really appreciate many colleges, so they are actively participating in the webinars, and they are trying to improve the skills. So this is the time you can utilize for you, so not wasting your time, and just so whatever you like you can read, and whatever you want to learn you can learn. So there are plenty of opportunities, and there are so many like NCRT and SWAYAM portals are available, where you can get the lectures from experts. So those kind of activities are also increased. So though there are no data available as of now, but obviously I believe there will be sometime these data will be available. Okay, so now we get into the picture. So what happens when SARS-CoV-2 infects? So as you know, it infects the lung, and the left lung, right lung, the trachea, then bronchus, and then finally the alveoli out there. So the infection is through nose and mouth, as you know. So that's why we are wearing mask, and these masks, so it can greatly reduce the spread of coronavirus. Once you wear a mask and social distancing, so it can obviously reduce the chance of infection. But there are recent reports which shows that the even in the air pockets, but it is not much evident, and a few groups they are mentioning that even it can transmit through air, but solid evidence is not there. As you remember, for HIV it has been 20 years people are working just to understand and to get cure, and it is just 10 months as of now. We are not completely aware of the SARS-CoV-2, so we still don't know, and it takes some time for the complete uh, removal of these virus, and until now we need to have the precautions based on the findings. So you should believe in the research findings, and based on that, because the strategy changes all the time. So how it infects and what way and what you need to do. So many people, the researchers, scientists, so they are and the social workers, so they are taking their life at risk, and they are uh, uh, trying to get a cure from coronavirus, and we need to follow that. So that will be our responsibility. uh, and we need to give respect those who are working actively for the cure. So in healthy alveoli, so you can see the red blood cells which has the hemoglobin and which transfers oxygen. So there is the epithelial cells, the type 1 alveolar cells, or the type 2 alveolar cells. So in type 2 alveolar cells, there are ACE2 receptors which are present and which are required for the entry of SARS-CoV-2 or the coronavirus. So these type 2 alveolar cells, they produce surfactants. So these surfactants which are required so that they will not be really sticky, because again fluid will be present, and this and when we breathe in and when we breathe out, it should not be sticky. So that's why there are surfactants which are present on the surface, which is produced by again type 2 alveolar cells, and type 1 alveolar cells are there, and this transfer occurs through this because of these diffusion of oxygen based on the concentration gradient. So that the normal gas exchange happens. So in case of infection, so there are the coronavirus or SARS-CoV-2 is there, and we have seen the structure of that. We have the spike protein or L-glycoprotein, and the ACE2 receptors which are present on the type 2 alveolar cells, and it can get into uh, that, and it can enter. So in infected person, the SARS-CoV-2 is present. And in case of moderate infection. So if there is a moderate infection, so there will be a vasodilation, the permeability increases. There will be recruitment of macrophages, and because of these signals we will see in a while, and there will be more inflammatory signals will be there. It infects the type 2 alveolar cells. Already we have discussed the ACE2 receptors which are present in type 2 alveolar cells. Because of that, the SARS-CoV-2 can enter the cells, and once they infect them, the mucus, the surfactant production will be lost, and that way it becomes more sticky, and there will be more fluid accumulation in that. So because of that, the infected alveolar cells, and there will be some kind of scar tissue formation will also be there. Some partial fluid accumulation will be there. Because of this, there will be some breathing issues. The shortness of breath will be there in the moderate condition. So at severe condition, there will be complete filling of protein-rich fluid, and the loss of surfactant will be there. There will be neutrophils, macrophages, infiltrations will be there, and there will be more and more protein and cellular debris, and the formation of scar tissue. So normally, if there is a damage, you see in the skin, again, they are epithelial cells in nature, and also the alveolar epithelium. So both the cases, when there is a damage, there will be a scar tissue. So there is the fibrinogen will be produced by those cells, these fibroblasts, and because of that, there will be scar tissue formation. So now you can define in your skin, if there is the scar formation is there, it will not be as similar to your normal epithelial cells, where the sweat glands will be there. In case of scar tissue, there will not be any sweat glands. Similarly, they are comparatively rough in nature, and the oxygen exchange is uh, inhibited. So almost most of the cases it is inhibited, and it is irreversible. So once there is scar tissue formation, it cannot be reversed back. So that is the major problem in case of severe conditions. So even if you kill all the viruses, it is difficult to get back to the normal uh, alveolar epithelial cells. So that was the major problem with the SARS-CoV-2 infection at severe condition, the reversal of the normal functioning of lungs. So there are few reports, it suggests that even a person is infected and got cured, the lung activity will be minimum at least 5 to 10% reduced activity will be there because of these kind of damages which are caused by SARS-CoV-2. So these damages leads to life-threatening condition at severe conditions, where people already having problems in the lungs, like even obesity, diabetes, and other comorbidities. So that is the other conditions with people, other the lifestyle diseases, which makes it more severe to get rid of or get the cure from SARS-CoV-2. And age-old people, again, there will be comorbid conditions will be there. With that, the complication increases for age-old people, and the mortality rate was around different countries. It varies, and it is around 20 to 50% for people more than 85 years of old. So, and the children up to 2 years of 2 to 3 years of old, it is only 0.05 percentage. We will see in a while what makes the difference. So why the young children, they are not really susceptible to these HIV, the SARS-CoV-2 infection. So we will see some mechanisms why they are there. So if you see the viral replication cycle or life cycle, so there are the S glycoproteins which are present on the surface, and it can bind to the ACE2 receptor. So angiotensin converting enzyme to receptor. And apart from that, there is one more, this is a protease, transmembrane protease serine 2, which is also required. So the serine protease activity, which cleaves the peptide on the surface so that the internalization can happen. So this the serine protease activity and the ACE2 receptor binding, so which these two are required for internalization of the drug. So here there are various strategies we will see at the end how we can stop at different points in this virus life cycle, and how we can find drugs or use the drugs to get the cure from SARS-CoV-2. Then it comes into the endosomes. So once they enter the endosomes, and then they need to escape from endosomes based on the pH difference, and then they should release the viral genome, and it should replicate, and the new virus formation should be there. Again, they will bud it out to the outside environment. It can infect other cells. So the virus binding, we can block it here, then internalization stage, or in during the trafficking stage or escaping from endosome. The hydroxychloroquine for malaria, as you know, it was very widely talked about the hydroxychloroquine drugs, and it actually it uses in this stage because it affects the pH of the endosomes, and which makes the virus not to escape from these endosomes. So that's how it is being. It can also be used for a drug for coronavirus. So a little bit detail when we see the binding, and then the viral RNA is released. So the endosomal formation, from that the virus is getting released, and then the virus RNA can get released into the cytoplasm. And the viral polymerase protein, with that the RNA replication can happen. With that, there will be many genes. That is there are 4 major proteins which is required for the package of the virus SARS-CoV-2. So the nucleocapsid proteins, which is bound to the viral RNA, then the membrane protein, envelope protein, as well as the spike protein. So these proteins are getting transcribed from the RNA, and then the translation occurs. So the viral structural proteins, they are translated into the endoplasmic reticulum, or translated and then to the Golgi apparatus. From that to the viral assembly part, and the nucleocapsid protein, which is there in the cytoplasm, and the viral RNA can bound with that. So together they form the mature virus. So finally the virus can get released from the cells and it can infect the other virus. So at different places we can stop these life cycle, and we can use the drugs for them. So now we will see what happens to the immune system. So this is the virus life cycle, and how our body trying to get rid of the viruses. So whatever infection happens, our body immune system will be triggered, and then we get the immune response. So even from a small ant bite, the antigen presence and or the picric acid, which are foreign material at that site, and that's why there are more infiltration of the immune cells, the macrophages or other antigen presenting cell, neutrophils, and there will be a dilation of the presence, and they produce more fluid condition, and because of that the more infiltration of the cells and the fluid accumulation that leads to the swelling at the particular place, right? So these immune cells again they try to capture the foreign bodies, and they show the major histocompatibility complex they present to other immune cells, So once they present to the other immune cells, and again it activates T cells, B cells, and antibody response or humoral response, and T cell mediated response will be there. In a similar way, once the virus enters into the cell, the viral RNA, viral proteins, these induces pyroptosis of the cell. So more viral replication, these pyroptosis is induced by these viral replication, and the viral proteins or different proteins can be released into the endothelial layer, and where the macrophages or other antigen presenting cells, they present to the T helper cells, and the immune system can get activated. So once they are getting activated, so these macrophages or other antigen presenting cells, they produce more cytokines as well as chemokines. So they are pro-inflammatory cytokines. So the inflammation, so that causes the inflammation. So there will be more fluid accumulation, and there will be more and more of immune cells infiltrations will be there. The T cells, monocyte, macrophages, they will be there, and they again they produce through interferon gamma again more and more cytokines and chemokines will be produced, and they produce a positive feedback. Because of that, there will be more and more infiltration of the cells, and uh, uh, they present these antigen, the virus antigens on the surface, and the T cells, they recognize them and they get activated, and it can produce both or it activates B cells as well, and it produces both humoral and T cell cytotoxic T cells. So both cellular and humoral immunity can get activated with that, right? So in normal case, what will happen in a normal scenario? So normally, once the alveolar macrophages, they recognize the cell, and there will be, it can induce apoptosis, and those cells get killed. And just imagine you need to get the neutralizing antibodies. And so just to brush up your basics of the immunology, so we have all the or most of the combination of the receptors, T cell receptors for any antigenic proteins, right? So if they are auto immune, or if they can recognize our own cells through the negative selections, those combinations will get cleared off, right? So these T cells and B cells, so the T cell receptors, TCR or BCR, so they have all the different combinations. If you are healthy enough, you will have most of the combinations. Your immune system is really active, and in that case, active in the sense you are not immune immediately to any viruses. So your immune system should get activated. For that, for example, the virus comes, your T cell, it should recognize the virus, and then it should get activated. It produces humoral and cell mediated immunity. If this receptor, if they don't recognize the virus, right? So there will be hundreds and thousands of different T cells and B cells will be there, and once they recognize only, they will get activated. So if they don't recognize, they don't get activated. So for that, you need the repertoire of the T cells and B cells, so that it can recognize the virus. Uh, your immunity is healthy, or if you are really healthy, and you might have heard with the nutrition and exercises how they can improve your health. Again, immune system, as you know, like the circulatory system, there is no separate pump. In case of circulatory system, heart is there to pump the blood throughout the body, but the immune cells, they move mostly in the lymphatic system, and there is no exact pumping mechanism for the lymphatic to circulate into the body. So in that scenario, you require exercises so that your stretching it activates the lymphatic vessels, or it gives pressure, the stretching and relaxing that uh, improve the fluid movement, the lymphatic movement throughout the cell or throughout your body, so that your immune cells move throughout your body, so that you the active immune cells will be present, so that they can recognize whatever the bacteria or viral infection. So that's how the exercises play a major role. Also the nutrients uh, to produce that much amount of immune cells, you again have need proteins, right? Because 50% of the drive weight of the cell, they are protein, so they are more important, and you require to synthesize protein, you need to take proteins also. So the nutrients and the exercises play a major role in deciding the immunity. And once you have the healthy immune cells, and the actual neutralizing antibodies will be produced, and that's how the T cell receptors, and they need to recognize the virus, the antigen presenting cells, and then the neutralizing antibodies can clear the virus. But if it is a dysfunctional immune system, so there will be, they cannot recognize the cells, but there will be more infiltration because of these cytokine storm, and then they produce again more and more cytokines. There will be more cytokine storm, and because of that there will be edema as well as pneumonia, and finally it can lead to the cytokines enter the bloodstream, and it enters throughout the body. There will be more cytokine presence, and there will be more infiltration of these cells. Again, positive feedback will be there, and that's how the multiple organ failure or multiple organ damage happens in case of dysfunctional immune response. So the whatever T cells or macrophages coming, the macrophages, though they can present the virus, the T cells cannot recognize, because it is not having the right T cell receptor to recognize. So that's why the neutralizing antibodies are not produced. Maybe some other antibodies will be produced. They recognize some other proteins, and those uh, antibody dependent, again the increase in the cytokine storm will be there, and that's why there will be more damage on the cells, more pyroptosis will happen, and apoptosis will happen. Then there will be more and more scar tissue formation will be there, and the oxygen transport will get affected completely, and also the because of cytokine storm, a multi-organ failure will also be there. So now you know the life cycle of coronavirus, and how our immune system can fight against the virus, right? So now we see why there is a difference between adults and children. So normally in case of adults, the SARS-CoV-2, the coronavirus, they can enter the lung cells, and here the lung cells, the infection happens. So increased IL-6, the pro-inflammatory cytokines. Already we have discussed about type 1 epithelial cells and type 2 epithelial cells. In type 2, it produces the mucus and other surfactants, and alveolar epithelial cells, they are for gas exchanger, they are there. And so this is in a normal case. So in case of viral infection, normal immunity also happens, and there will be more cytokine production if the person is healthy or active immune system, and they can get immunity against SARS-CoV-2. The person is not very healthy or active, so in the active immune system, and in that case it takes longer time to develop immunity. So one thing to remember, like all common cold, like there are no medicines for common cold, because it's a virus. It should finish the life cycle, and to get our immune system, it takes 7 to 10 days to produce the uh, antibodies or the cytotoxic T cells to kill the virus. So in case of children, what is happening? So normally in case of just a minute. So normally in case of children, the more active epithelial cells will be there, and one important thing is the ACE2 receptor, which is there in the type 2 epithelial cells, which are really less in case of children. So from the newborn babies to up to 12 years to 15 years, the ACE2 receptor slowly increases. So if you see the number of ACE2 receptors in the cell, they slowly increases with the age. So in that case, the very less ACE2 receptors, the uh, SARS-CoV-2 or coronavirus, they can really cannot infect the cell. So that is the first reason. The second reason, the reactive T cells. So they have taken. So there are two different strategies. So one is like the viral interference. So they are really prone to common cold, where again already we have discussed there are many coronavirus which they cause very mild symptom colds, and there are sequence similarities which are there around 30%. Because of that, the T cells can be activated immediately, like memory T cells, they can get activated immediately, and then because of that it can get reduced. So similarly, the interference of the immune system. So they have taken, if they have taken MMR vaccines, the measles, mumps, rubella vaccine, again, with those vaccines, there are around 90% homology is there with coronavirus. So that again, the immune system can get triggered, and immediately there will be responses. So these cross immune responses, because of if they are infected with, one study, it shows that around 20% of the kids, they have other coronavirus at the time of whoever got infected, COVID positive kids, they have 20% of them have other uh, coronavirus, which is not SARS-CoV-2, a human coronavirus, which again cause very mild symptoms. So in that case, already they have developed, because of that human coronavirus, they develop some immune system, and they help to reduce that infection. So then the MMR vaccine also, they have 20% similarity. Again, they give immunity for them. And the so we have the next one is the T helper cells 2-arm. So in case of T helper 1 cells and T helper 2 cells, in case of adults, they produce more and more pro-inflammatory cytokines, whereas in case of kids, they don't produce pro-inflammatory cytokines, whereas the TH2 arm, they produce more anti-inflammatory cytokines. They reduce the inflammation, and therefore there will not be more uh, infiltration of these macrophages, and that's how the damage can be avoided. And these eosinophils will also produce anti-inflammatory cytokines, and it is different in case of kids, and that's how you can get rid of these infections. So if you see normally there will be cross-reactive T cells, and which gives uh, uh, some immunity against coronavirus, and the ACE2 receptor uh, number. So apart from ACE2 receptor, the transmembrane protein serine 2, so they are also reduced in case of type 1 alveolar, and in ACE2 receptor in type 2 alveolar cells. So they have the protective Th2 immunity, where we have seen the anti-inflammatory cytokines will be produced, and the protection from eosinophilia driven by these Th2 cytokines, which produce anti-inflammatory cytokines, and which is again protecting against coronavirus. So the lower levels of pro-inflammatory cytokines, and the they are really less in case of children. And IL-6, the pro-inflammatory cytokines, they increase with the age. So these are the reasons, various different reasons, where the children, they are not very prone to these COVID-19. But one statement is they are mostly asymptomatic in nature. So all these produce the asymptomatic condition, but they are the spreaders. So they have, when they check the viral content in pharynx, there are more number of virus which are present. So though they cannot infect the lung epithelial cells in pharynx, there are more and more virus are produced, and that's why they are though they are asymptomatic, they don't develop any inflammation or the breathing issues in lung. The pharynx is getting affected, and with that there will be more and more viral load, and they can easily spread to others. So that's why the children, they are more asymptomatic, but they spread a lot. So if you see the three curves, if the uh, country which is reducing the COVID-19 cases, so the probability line will be like this, and there are serious outbreaks. So right now in India, it is in increasing conditions. So there was a serious outbreak, and some mixed messages. So that means it is not the strategy was not very much followed, or there will be a lack of detection, and the finding out the people with contact. So there was some kind of problem, and that's why there is the mixed messages can be there. So what happened through in 10 months, maybe earlier? So we now know that how the virus enters, and what our immune system does, and what is the difference between children and the adults. And now with the lockdown in our environment, and the socio economic values, so what happened to them, we will just briefly see in 5 minutes maybe. So the NO2 level over China from January 19 to March 8. So within 2 months, there was very great reduction in that. So from very high emission to low emission. So from the environment, there was a positive thing. And in case of Italy, so there was again the nitrogen level from very high to reduced very low. So in environment, there was again protection because of these lockdowns, even in Delhi. So there were instances, they have taken the photos of the nearby mountains and all in various different places in India. And in New Delhi, there was so much reduction in the pollution. So what happened, the emotional impact? So this was in for the US population, but I found it was very much relevant to Indian population as well. So in case of distress, the distress was very, whether it is high, low, or moderate. So in case of male or female, there was 51% it is moderate, and it was high for around 20-25% people, and remaining low for these people. So half of the people there were moderate distress, and for quarter of the people there are high distress. And there was the age group, the moderate distress, there was not much difference, but in case of high distress, the younger age people up to age 34, there were more distress compared to age old people. So this was something which is not uh, uh, expected, because the distress, the risk is really high for age old people, but the distress level is low in case of age old people. That is because uh, uh, in case of the that age 18 to 34 or 35 to 49, they need to go for work, and they need to protect their family. So that capability, because of that, the more distress is there at those age group 18 to 49. But whereas higher age group, because of maybe the responsibility difference, there was decreased stress, the high distress in case of uh, higher age group people. And again, children under 18, they have more distress for the parents, and without children, they or children above 18, not much distress. Again, they want to care for their children, and maybe in India it may be really high in case of parents with children less than age of 80, and less than 18. And the city or town or village, or outside of cities, towns, and villages, the low distress level is really high at the outskirts of the villages. So that even I have seen in Tamil Nadu, at villages, they did not worry much about corona. So they were doing farming or those local jobs. They are not much affected, and the distress level is really less at that places, and it is really high in case of cities. So the education, if they are high school graduate, or any graduate, undergraduate degree, or schooling, and there was not much difference between whether it is low, moderate, or high. So around 50% they have a moderate distress, and 25% low, and 25% high. So that was the normal level. So normally the like a Gaussian curve, high 25%, and moderate 50%, and low 25%. So that was the statistics throughout, and some places there were some differences. And 18 month, what really can be affected? So the global recession can happen. So that is the first thing. And in the bank or different industry, the employment, and the major economy weakening. So everything can happen, and likelihood to have. And in case of less, it is like IT breakdown, the chances are less, because work at home and these online platforms. So previously it was very difficult in online platform. With the available technology, it is now easier to have without in contact, we can have the online discussions and all. And that's why the these chances, the decarbonization efforts, and these are all very less likelihood to affect. But the recession in the banks and the industry fail to recover, so there are more chances of these. Again, various different industries, if you see many places, there are from 2% to around 50-60% chances are there for many industry to fail. So Socio-economically, it affected, the pandemic affected a lot. And finally, the daily cases in India, it had started to reduce now. So this is the recent data. So from starting from September, it started to decline. So this is the daily new cases. This is a 7-day moving average, and it started to decline now. And hopefully, in a month or two, it start reducing. But again, uh, uh, we need to follow the social distancing, and we need to wear masks so that we try to avoid the new infection or spread of new infection. So the active cases also, the new infections as well as the active cases, there are more recovery, and that's why it started to reduce from the month September. So the number of active cases are also started to reduce. But one point to remember that the daily TPR, so that is the new tests taken every, so the new positive response or positivity rate. If you see here, this is the new tests. They are taken really high, and they are trying to reach a plateau, and the test positive rate also started to decline, and there is an increase and there is a decline. So whether they are using RT-PCR or kit, or how much reliable, so there are some discrepancies are there, and in this region, because the test positive rate, if they are still increase, here it is getting reduced now. And if there is increase again, because we don't know the reason why the new test plot and the test positive rate plot, there is a difference in that. So this needs to be clarified by the government or agencies to, so still we don't know the reason why there is a difference in those plots. So normally the positive rate should decrease, and when the new cases started to falling down, but there was sometime there is increase and again there is decrease, so it was not following the actual trend. So finally, now we know that the active cases are getting reduced, and the treatment also. There are various approaches and vaccines already, the human trials and all going on in Russia or UK or in US. In India, it had also started, and there are various different ways, as we had discussed. We can stop it from the transmembrane serine protease inhibitor, so that the protease activity can be avoided, which is camostat mesylate can be used, or the fusion inhibitors, arbidol, can be used, so that the fusion can be avoided, or the Cas9 adenoviral vector, the CRISPR-Cas9 system, which can be used to cleave these. So as already we had discussed, the CRISPR-Cas9, it can cut the DNA, so that the genome can be removed in case of HIV-1 infection. So here also it can also be used at this stage. Once the RNA comes down, it can be chewed off, or at the stage before protein synthesis, that time also, after RNA synthesis, this can be chewed off. And then protein synthesis inhibitor, or then the chloroquine or hydroxychloroquine or baricitinib, where the from endosome the virus should release, or virus RNA should release, and it can keep the virus in the endosome, so that the lysosomes can bind and it can degrade the virus. So, and at various different ways, after RNA synthesis, we can inhibit the to protein with specific inhibitors, and then IL-6 receptor. So this is to avoid the cytokine storm. So in that case, we can use IL-6 inhibitors or ACE2 receptor inhibitors. So these are the various different ways we can use the drugs. So the antiviral drugs like antibiotics, these antiviral drugs can also work at different places, and they are really specific for a different virus based on the mechanism, based on the life cycle of the virus. And finally, so as nanotechnologies, there are various approaches using nanotechnology to cure or to give a treatment for COVID-19 PPE kit, which can virus, and the photodynamic therapy, which produce reactive oxygen species to kill the virus, and the nanomaterial based vaccination. Also the targeting ACE2 receptors. Targeting is one of the criteria using nanoparticles, and which can use these ACE2 receptors so that the drugs can directly enter the cells to kill the virus in those cells. Finally, in case of COVID-19 nanomedicine, from the therapeutic challenges, the repurposed antivirals, we have discussed about how antivirals can be used, and we can engineer them and modify them, and then put it in a delivery system so that we can increase the solubility, bioavailability, or reduce the toxicity. We can induce the immunity, and which can cross the different biological barriers and increase the half-life. So these problems can be sorted out when we can use these nanoparticles. Also, the for vaccine purpose, it can also produce a more immune response by the uh, uh, the tissue barrier transport, and it can target both adaptive and innate immunity, and we can target the antigen presenting cells. By this way, the vaccines can be more effective when nanoparticles or nanomedicine can be used. So we have discussed about from coronavirus starting to how they entered to how different technology therapeutic strategy can be used to cure that, and we have also discussed about socioeconomic problems with that, and through these 10 months. So thank you all, and I'm ready to answer your questions. So if you have any questions, you can ask me now. Also, you can mail me at any time so that I will respond to your queries. Thank you all.
Thank you, sir. Am I audible?
Yes.
Yes, sir. Thank you, sir, for elaborately explaining about the history of pandemics, and particularly about coronavirus pandemic, and also the effect of coronavirus on human race, and the recent technologies and treatments used to control it. Can we have the question session, sir?
Yes.
Dear participants, you can ask questions. You please unmute yourself and ask questions.
Good evening, sir.
Yes.
I'm Dr. Angel.
Yes. Tell me. Can you hear me?
Sir? Okay.
Sir, I would like to ask a question.
Yes, yes,
Um,
please.
so, what is the permeability of COVID virus?
Permeability into the
So,
epithelial
as
cells.
day-to-day life, we are using different types of masks.
Sorry.
Some people are using cloth mask,
Mm.
mask,
Yeah.
the mask which we are using for the protection.
Mm. Mm.
Some are using cloth mask, and
Mm.
some are using 3 layer, 4 layer, and different layered masks. So I would
Mm.
like to know that what is the permeability of this COVID virus, and which type of mask will prevent this?
Yeah, obviously the N97 or 99, so they can give a better protection, but again it spreads through droplets. So the droplet size is more micron. So uh, if both the persons are wearing masks, so one is infected with SARS-CoV-2, another one without infection, if the infected person sneezes, so most of them will get arrested in the mask itself because of the droplet size. Even if they are using a cloth mask, it can stop those droplet spread. But obviously there will be difference, but almost 80% of the particles will be stopped by the cloth mask, and the surgical mask around 90 to 95%, and the N95 99 mask almost 99% of the virus can be stopped. But again, already if the virus is there in the environment, the small droplets, they take some time to settle. So almost they will be there in the air for 2 hours. The recent findings it's showing, again, it is that's how it is really not advisable to get into a crowded place or a closed environment where the virus particles can be there for a little longer time, and the small droplets, even a small time, if you remove the mask, there are chances of those virus particles getting into your system. So that is about with the recent studies. Maybe there will be more advice will come from the government side based on that.
Sir, and one more question, sir.
Yeah.
In day-to-day life, we are using many electronic gadgets.
Mm.
So, what is the survival of COVID virus in that?
Yeah. So there
Day-to-day
are
life, we are using keyboard, laptop screens, mobile
yeah.
screens,
Yeah. So there are again studies which try to isolate RNA from the gadgets, from toilets. So even the toilet sewage, they have isolated RNA, the coronavirus RNA. So they stay for longer time. Even for 2 days they have detected and different surfaces. So normally the smooth surfaces, so they stay for longer time, and in copper only 20 minutes to 1 hour it stays. So based on material to material it varies, and obviously the number of particles required to get the infection will be really less. So very minimum percentage will be surviving. So if there are 1,000 particles are there, around 5 to 10 particles only be there for 2 days. Sorry? So in that case, they cannot uh, cause any infection. So definitely the virus will be there from if a person is infected and he sneezes, and it will be there on the surface. But after an hour or two, the infectious particles which or the virus particles which are required to give the infection will be really less.
Thank you, sir.
Thank you, sir. The smallest act of kindness is worth more than the grandest intention. Appreciation can make a day, even change a life. Being grateful is not just an attitude, it is a way of thinking. Now, I invite Mrs. T. Bhuvneshwari, Assistant Professor from the Department of Nutritional Dietetics, to deliver the vote of thanks.
It's my privilege to have been a lot of things in this position. I extend my sincere thanks to our Secretary Sir, Ashish Sir, Assistant Secretary Sir, Professor Sir, the Directors of Secretariats for their encouragement. I would like to thank this opportunity to place on record our hearty thanks to our Principal Sir, Vice Principal Sir, and Additional Vice Principal Sir for their moral support. I extend my special thanks to today resource person Dr. Divya Prakash, Professor, Department of Bioengineering, Sasta in University of Tanjavur, for readily accepting our invitation for the grace these occasions. So your session is very useful to us, sir. So our students also get more information regarding COVID. So they are absorbing your presentation, sir. So I express my wholehearted thanks to HOD sir for his continuous support and motivation in all our endurance. I wish to extend my thanks to our teaching and non-teaching staff, members, and students, friends. Once again, I thank you all. Thank you, sir.
Yeah, thank you all for giving me the opportunity, and thank you everyone.
Thank you, sir.
Let us all raise for the national anthem.